Dr. Melanie Palm from Art of Skin in San Diego, California. Today we are demonstrating the Infini, which is a radiofrequency device that actually uses teeny tiny microneedles to deposit that radiofrequency, not through the epidermis and causing damage down into the dermis. So it really is a combination of two great modalities. Small needles to encourage collagen growth, but then using that radiofrequency once the needles are actually in the skin to give that extra pow. We are treating our patient's neck today, going after skin laxity or looseness, and also trying to improve some of the wrinkles. We're going to work on some other areas of his face, but I just wanted to demonstrate a little bit of the radiofrequency technology on the neck. It's really quite straightforward. The patient's had some topical numbing on, and we'll just sort of speed on through in a little pattern. I've actually treated the left side of his neck. Causes a little bit of redness, which lasts for about a day or so, and the skin can feel a little bit sandpapery, but other than that, there's not much downtime really at all. Patients can use just sort of a mattifying sunscreen for a day or so. And so we're going to have you come in for a little closer view, and I'm going to get started along this neckline. So we'll go on 3. All right. 1, 2, 3. You can see I'm not overlapping, I'm just getting right adjacent to it. And each of these clicks is sending 49 little microneedles into the skin. And once the needles are deposited, this radiofrequency energy is delivered, and this causes a thermocoagulation zone, which is basically an area of heating delivered to the collagen that stimulates more collagen growth and skin tightening and tissue remodeling over the subsequent weeks to months. This is usually done as a series of treatments. I usually space treatments out about 4 weeks between each treatment period. And it does take a series of treatments. You know, everybody's a little variable, but I tell patients usually around 2 to 4 treatments for the average, but you know, every individual varies. You can see this goes really quickly. The patient's in no distress, is sitting here comfortably. And in some areas we use different techniques. So right now I'm sort of stretching the skin to make sure we've got an even platform to deposit the little micro needles. In some areas we'll actually use a pinch technique. That's more common on the face. But this is very thin tissue. So we sort of spread the skin to make sure that we're getting an even deposition of the needles. Occasionally you'll just get a little bit of pinpoint bleeding, so we just wipe that away. That's not something that lasts. And what I like about this device is that it can be used on a variety of different skin types. So because it doesn't concentrate the energy on the top surface of the skin, the epidermis, where people can experience pigmentary problems, it instead sort of circumvents that and is able to go down to the dermis. We can use it on light skin patients, such as this patient here, but we can also use it on skin types 4, 5, or 6, patients that actually have olive or pigmentation to their skin without having as much of a concern about pigmentary changes down the road. So that's a demonstration of the radiofrequency device called Infini by Medtronic. If you have questions, visit our website. It's artofskinmd.com.